inspiring stories, all of them. And I think a couple of things I think that stood out. Shiban, you mentioned the S's, scalable, speed, sustainability. So the thing that struck me was sustainability. So as you're growing now, you started off in UP, you're now here. How do you address that, or what are your thoughts on looking at sustainability as the organization grows?
Can I preface that with
Absolutely.
a comment on his? We run an organization that is ready to experiment of any healthcare conceptual solution or gadgetry solution you have. We have access to 2 million people. From concept to execution is 1 month. We're designed it that way. So I'm inviting all of you, including him. You want to experiment, see what works, what doesn't work. Our platform is ready for you anytime. Like I said, 2 million population, statistically valid data. We'll collect the data for you, feed it back, retweak it, do whatever you want to do. At the end of it, prove or disprove the model. And we've done in, like I said, 25 modules of healthcare, including healthcare finance. I'll come to that in a minute. Something very exciting has happened. And we've done health IT in place in UP, where there's no electricity, no connectivity. Because we've got to solve the problems in real time as they exist and not dream for a utopia when the politicians get less corrupt, when the potholes are created, when the global warming doesn't happen, then I will come and do the healthcare. It doesn't work that way. The real things. So we are here to help you and create any other model in the audience. That's number one. Number two, to me, whichever way you cut it, sustainability is positive cash flow. If you're positive cash flow, you're sustainable. We are ashamed to say that word because it's kind of shameful word to say that you want to make profits. Unfortunately, in healthcare for the poor, there is no positive cash flow. Healthcare nowhere in the world can be sustained only by either insurance companies or rich for the poor or young for the old or healthy for the sick. Government subsidy as a part of social justice system in an egalitarian society has to come in. The key is, how can we keep costs low that becomes sustainable with minimal investment? That's where the cost of healthcare comes in. So we raise our own funds only in the beginning. For example, we run 16 free clinics there, free in the sense, again, to do a cost model, to find out exactly what is the cost of transaction. So we give all free medicines, all free consultations. It's a walk-in thing. Surprise, surprise. The cost per transaction for any comer that goes in, averaged out, is 12 rupees. In other words, at 12 rupees, I break even. That's my cost of delivering healthcare. We see 150,000 patients a year. So now if I charge 14 rupees, I make profit on this. The problem is, when you see the government system, they spend at least 10 times that money for the same outcomes. To me, scalability will come if we keep the cost low and the government and the philanthropists subsidized to an extent. I want to give you one more line. Like I said earlier, we work in advocacy, and something fantastic is happening because being in healthcare, I said we got to do two things in the country to make it cheaper and inexpensive. And now working with the higher echelons, two things we started 5 years ago, give a national health IT infrastructure. That should be the backbone, which is happening now. NIC is developing the software, it'll be cloud-based, given free to all the doctors in the country, just upload it. That's number one. Number two, healthcare finance is what drives healthcare, wherever in the world. So how do you deliver healthcare to 1.2 billion people, which I said earlier can't be done without government subsidy? So we're working on a thing called universal health coverage, that the government of India will provide health insurance for every Indian, poor, middle level, rich level. It's part of the 12th plan, which is just starting. 1.83% of the GDP will go as health premium insurance for the government, go up to 3% 15 years later. It'll be phenomenal. The 1.2 billion people of the world will be covered from primary to tertiary care, one form or the other. It's already been accepted principle. We are working on the creating pilot studies. We'll do 3 pilot studies. I'm deeply involved in this. Thank you.
That's really exciting news. Adam, you come from a different focus and different scale also. How do you all think in terms of sustainability, or what is your perception of keeping things going over there for KSV?
Well, I guess the main thing for our sustainability, because we provide a a free education, it's a financial sustainability, that we find a financially sustainable model. And this is not something we want to do by putting some of our students to different tasks where they do something to generate some income. We feel that, you know, it's their childhood, it's the time they should be learning. They need to concentrate on that. It's our responsibility to get more into fundraising, and it's building long-term partnerships with our funders that is going to enable us to scale up should we want to scale up. But when we look at growth, we can look at that on two ways. One is in terms of quantity, and one is in terms of quality. And for sure, at the moment, we're focusing much more on quality. We're looking at what, excuse me, we're looking at what we have, and we're trying to improve on that. And we're trying to have improve better services, improve our processes, provide better facilities to our students. And alongside funding, which is a challenge to our growth, also human resources is another challenge. And this is something that is very much also linked to funding. As we're a modest, small NGO, we have a limited amount of funds coming in. It means that, you know, our salaries are also quite modest. It's difficult for a small NGO of our size to compete with the government. The government, they offer very nice salaries. They offer a lot of fringe benefits. A lot of people are going for this, for the job security. Perhaps it might not be as fulfilling as working in an organization like ours, but it's very difficult for us to compete with that. And over the years, we have lost some of our staff that they've gone across to the government stream. It means that then we have a fresh batch of staff come in. Again, we have to do staff training, capacity building. So the challenges to our growth are funds and human resources, which, again, I think are inextricably linked.
Stephen, you obviously you all have been around a while and in a number of countries. Have you all come up with any innovative kind of public-private partnerships or approaches either in the US or elsewhere that has helped you all scale?
Yeah, when we think about scalability, there's kind of three elements. There's programmatic, advocacy, and financial. Programmatic, we don't ever go to a school that doesn't put something in. They may put in time, they may put in money. So we don't want to convince them to educate kids who are blind, because it won't be sustainable then. We'll do the training. We'll leave 6 months later, they won't be doing anything. So they have to be committed in some way and put some resources in, so whatever that is. The second thing is parents. Parents are a key element. If we can empower parents, they then will be the ultimate educators for kids, but they also will be the ultimate advocates in the government. They'll have a lot more power than I will, than the local school administrator and the teacher. So we spend a lot of time educating parents about the potential there, and letting governments know about the opportunities. And then the third is financial. We have 300 partners around the world in 67 countries, and of those, for every dollar we invest, they collectively put in $9. So that they put up a lot. That's not every partner every year, but collectively, so that we try to find that sustainability, help them. So one of the things we may do is we may do a seminar for a local school on how they can do fundraising. So it's not part of our official job, but to get them going as part of that element. And so there's an educational sustainability, there's an advocacy sustainability, because ultimately we want the government to take responsibility. I'll never forget, I've been in 3 countries, this didn't happen in India, but in Africa and Eastern Europe, where government ministers said to me, we don't think kids who are blind should go to school. I mean, it's just very simple. They weren't really debating it. So you're, in some cases, starting with those areas, or in some cases, starting with religious issues or issues of karma or other kind of beliefs. So we have to deal with those stigmatism. There's a woman I met in an Arab country who she's blind and she didn't have a cane. And because if she had a cane, her brother would never get married, because the belief in the village was that if she had a disability, all the family would have a disability. So there's a lot of those issues to try to raise awareness as part of that, as part of the sustainability.
Mahantesh, every time I meet you, you have yet another new program that you come up with. How do you find the resources for this? What are some of the innovative kind of sources to help you scale? Some interesting partnerships with the government. What has Samarthnam done that helps it get to where it is?
Thank you. So 3 major focus of Samarthnam. One is being innovative to the growth, and 3, sustenance. And we keep adding new programs every now and then. So majorly what we do is we network and partner. Like I mentioned about the Trustee, the call center training, it's a public-private partnership. So DFID, international agency funded Government of India under capacity building for poverty reduction. They funded to set up several initiatives to poverty elevation. So they gave part of the grant to Government of Karnataka, which they in turn routed it to Samarthnam. But that money was not full. So what we did is we requested a couple of corporates and also the Deshpande Foundation. The Deshpande Foundation gave away the space which we inaugurated here, and a software company came forward and chipped in the balance. So Samarthnam, in its 16 years of close to 16 years journey, has built goodwill and corporate partners and government departments, both departments which work for disability, department for education and human resource. So we work very closely with them, and with some of them we also discuss at a policy level. So as a part of our advocacy initiatives, we keep organizing several events like the T20 World Cup and the National Chess Championship for the blind, like this. So we invite the bureaucrats and the corporate captains to be guests and witness the happenings. So that is one of the selling strategy which Samarthnam has been very consciously doing it. And as Adam said, human resource is a big challenge. So what we do is we extensively work on capacity building with the team in Samarthnam. And primarily, it's my dream, we should have as many visually impaired as possible as the marketing officers for Samarthnam who could themselves go and promote and propagate this. And also, I tell my visually challenged folks that they should become the taxpayers of the country rather than depend on the doles of the government. So some of these thoughts which we constantly talk about, and events we organize, and the reports we send it to our stakeholders, annual reports, and audit reports, abstract of the audit reports, and the media. The major development of Samarthnam, or the growth, has been huge support from the media, sir. So we don't shy away from media. We don't kind of keep ourselves away from publicity. We believe if we can talk about Samarthnam, the good activities we are doing in media and through other promotions. We also display hoardings when we organize events. We liberally distribute flyers about the event. So that way you kind of communicate what you are doing to the mass. So neighborhood community support for Samarthnam has been the major sustainability. And they go and talk to their companies, bring money from their companies. So like this. So involvement of most people from different walks has been one of our success. So hope I answered in brief, sir.
No, thank you, thank you. So Ramesh, obviously, thanks for sharing those couple of examples of starts that didn't work. I mean, now you're looking at this new approach that you're going to be taking. How are you, so what's the for-profit, non-profit kind of components over there? How are you all working with that? How do you maintain a social mission while you're still trying to, I'm assuming, a for-profit kind of scalable approach?
Yeah, so after talking to our mentors and talking to a lot of people, it was very clear that we have to set ourselves up for scalability, because the problem is too huge, and showing success in a small segment or a small city will not be enough. So that's our hypothesis, and the hypothesis is that if we co-opt the existing players in this particular market, which is optical stores and doctors and ophthalmologists, if we give them enough tools to be powerful, they in turn will do the social inclusion for us, because they will continue to make profit down the line, And when we talk to all the stakeholders, all the way from governments to big aid organizations, to eyeglasses makers, to frame makers, to eye clinics and so on, and they all said, we'll be able to come up with flow of money so that the service is delivered to the people who cannot afford it. But show us that you can scale to tens of thousands and millions very quickly. So our goal is to reach those numbers, and we feel, at least that's how we feel right now, that rest of the money will follow, that will trickle down to people who can't even afford glasses or cataract screen.
So yeah, immediate this thing to do like a pilot scale thing to show the scalability
That's right.
of what you're doing.
That's right. We are still in early stages.